Hi, today we would like to review how to measure active and passive elbow flexion. First, we will describe the biomechanics of the elbow joint. Elbow flexion occurs in the sagittal plane with the radius moving on the capitulum and the trochlear notch of the ulna on the olecranon fossa. The capitulum and the trochlear notch are both concave surfaces that move on the convex portion of the humerus. This means that in flexion, there is an inferior roll and glide followed by a superior roll and glide at end range for both these bones. The primary muscles involved in this action are the biceps brachii, brachialis, and brachioradialis. All three muscles cross the elbow joint. The test will be done with the hand supinated, which biases the biceps brachii slightly. Next, we'll talk about indications and contraindications for measuring elbow flexion. Measurement of elbow flexion is indicated after injury to the wrist, elbow, or shoulder, or if weakness of the muscles around the joint is shown during examination and screening. It might also be measured as a comparison for the contralateral elbow. Disorders that may cause decreased range of motion, such as diabetes mellitus, multiple sclerosis, burns, etc., also indicate measurement of elbow range of motion. Contraindications would be any red flags requiring referral, a fracture of the distal humerus or proximal radius and ulna that's still in the acute phase, open wounds, or any post-surgery precautions detailed by an operating physician. Research indicates that intra-rater reliability for measuring elbow flexion is significant. Other studies have shown that, when compared to a radiograph, goniometry shows a maximal range of motion error of no more than 10 degrees. Next, we will discuss the steps to measuring elbow flexion with a goniometer. First, position the patient in a supine position with a rolled towel under the triceps to support the upper arm. Expose the area to be measured. Next, identify and palpate the following landmarks: the lateral epicondyle of the humerus, the center of the acromion process, and the lateral midline of the radius using the radial styloid process as a landmark. These will be marked with a Sharpie during this examination to demonstrate their location, but this is not standard practice. Align the fulcrum of the goniometer with the lateral epicondyle, the proximal arm with the midline of the acromion process, and the distal arm with the radial styloid process. Make sure the goniometer is not touching the skin. Next, have the patient flex and extend the arm to visually assess willingness to move and range of motion. If necessary, show the patient how you would like them to move. Have the patient extend their arm as far as they can and align your goniometer with the landmarks. Assess that they reach 0 degrees of extension. Next, have them bend their arm and measure their flexion. Make sure your head is at eye level with the goniometer. For passive range, press down on the wrist to assess extension. Then bend their arm while they relax. Measure flexion. Make sure you're applying enough force to get an accurate measurement. The active range of motion at the elbow joint is 0 to 145 degrees normally. Functional range of motion would be 30 to 130 degrees. A smaller range than this will decrease reaching distance. Infeel should be soft in flexion. A firm or empty infeel around 140 degrees is unexpected and could indicate pathology, pain, or tightness. A hard infeel at 0 degrees of extension is normal. Now it's time to bring it all together. We will show you a short video showing patient interaction. Make sure you keep your language understandable when interacting with a patient. Hey Julie, how are you doing? My name is Scott Heineken. I'm going to be your physical therapist. Let me just wash my hands real fast. So today, the purpose of today's visit is I want to measure the range of motion of your elbow. So to do that, I'm just going to have you lay down on the bed.
Okay,
all right?
I'll take my shoes off.
Yeah, go ahead. And I want you to just slide towards me a little bit so your elbow is just on the edge of the table. And place your palm up towards the ceiling like that. Alright, that looks perfect. Are you comfortable?
Very.
Great. And during the test today, you might feel a little bit of tightness or pulling your elbow, but it shouldn't be uncomfortable. So if it is, please let me know. So what we're going to do is I'm actually just going to have you bend your elbow like that, okay?
Okay.
As much as you can. Good. Okay, Julie, so for this test, I'm going to have you straighten your arm out as much as possible and then bend it like this. But before we do that, I'm going to need to get everything in position, okay? So what I'm going to do is I'm going to have you just straighten your arm for me, and I'm going to feel for your elbow bones, and I'm going to feel your wrist, and I'm going to feel your shoulder. Alright? And can I have you just bend as much as you can for me first, and then straighten out as much as you can? Good. So I really want you to make sure you straighten out a lot at the end, and then when you come towards your shoulder, keep your palm towards your shoulder like this. So don't go like this, go like that. Okay?
Okay.
So let me just get this in position and we'll do a measurement. And palm up. There you go. Awesome. Okay, so really straighten your arm for me. Good. So I'm getting 0 degrees there. Now I want you to bend your elbow. Remember, palm towards your shoulder. Good. Okay, I'm getting 157 degrees. That's good. Alright, so next I'm going to actually just move you myself, okay? So I'm going to start by straightening your elbow. And I want you to just try and relax as much as possible. Alright, good. So let me just push you down. Alright, so I'm getting -2 degrees there, and then I'm going to bend your arm. Yeah, just let me move you. Alright, there I'm getting 159 degrees. That looks good. Alright, did you have any pain or anything with that?
No, no problems.
Alright, great.
Okay.
Well, it was nice meeting you, Julie, and that's the end of our visit.
Great.
Cool. That concludes our gait video. Thanks so much for watching.